The following is a presentation on the West End. In this presentation, we will provide you with an assessment of the West End, as well as our plan, driven by the assessment, to assist the West End as it strives to embody the objectives set forth in Healthy People 2020, improved healthcare for its community members.
There are two primary concerns that have been identified through the Phase 1 community assessment. One is the lack of available health services, and the other is diminished access to healthy food choices within the geographic border. There is endless data on the impact of diet and nutrition as it relates to health risks and chronic illness. The Office of Disease Prevention and Health Promotion indicate that a healthful diet reduces the risk for obesity, heart disease, high blood pressure, anemia, dyslipidemia, type 2 diabetes, and osteoporosis, among others. This makes health promotion and disease prevention an important topic for public health nurses. Other data, such as the fact that 50.4% of people in the West End live below poverty level compared to 26% of persons in the Cincinnati area, contributes to this problem chosen. Poverty is a known contributor to and social determinant of health. Often, literacy levels are lower and transportation is limited, both of which affect access to care and nutrition. To address these health concerns, a nurse can utilize the National Directives of Healthy People 2020. The two objectives related to the West End community problems are as follows. Reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care, dental care, or prescription medicines. The other is increased consumption of fruits, vegetables, grains, and calcium, and decreased consumption of saturated fat, sodium, and calories from solid fats and sugars. In order to improve the primary health concerns of the West End, outcomes must be established. Healthy People 2020 proposes specific outcomes related to these problems, which includes community members will have knowledge and skills to make healthier choices, and healthier options will be available and affordable. And finally, coverage, services, and timeliness of healthcare options will be improved. The outcomes set forth by Healthy People 2020 provide guidance for nurses to conduct a meaningful community assessment and plan appropriate interventions. In the case of the West End, chosen interventions for nutrition include primary, secondary, and tertiary measures, all conducted through a health fair within the community. Primary prevention includes education about nutritious food groups, sample meal plans, and grocery lists. Secondary prevention includes biometric screening, including BMI measurement and a lipid panel. And tertiary prevention includes nutritious food samples being provided to attendants. Proposed intervention measures to improve access to health care include education about government services to improve coverage rates, facilitating appointment scheduling and transportation to appointments, and a health fair with access to annual checkups with local physicians. In addressing both problems, it is important to collaborate with local leaders or stakeholders. Building a coalition unifies members of the community for a common cause and involves members of the community in improving their own health. Additionally, because the largest hurdle with nutrition is the lack of availability within the community and lack of transportation to retrieve healthy food outside of the community, it is crucial to bring nutritious sources into the community. Coalitions can help by achieving the goals of stocking existing mini-marts and gas stations with more nutritious choices, along with the development of community gardens. This will reduce the need for travel outside the community and involve the community's own members in their health.
On this slide, we will discuss the similarities that are apparent between the data that was gathered in the West End and that of national benchmarks. When comparing the data from the West End community to the city and national levels, we are able to gain a more comprehensive understanding of the community makeup. Population characteristics that were investigated include the total population, median household income, persons living in poverty, and demographics such as sex, race and ethnicity, religion, and education level. Of the data provided in this slide, it is clear to see that there is a large disparity in median household income and a higher than average number of people living in poverty when compared to the national census. Considering the population data, we know there is a segregated racial makeup, lower income and education levels, and higher poverty than the national average in the West End area. Some of these statistics are considered social determinants of health, which Healthy People 2020 have correlated to impacting the ability to achieve optimal health. The U.S. Census report showed that the West End population was 89% African American race alone, while less than 1% is Caucasian. Objectively, of a 6,627 population, over 1,200 have some high school education with no diploma, which Lochner and Moretti point out that even small reductions in crime can be associated with higher education levels. In conclusion, the West End has large discrepancies compared to the national benchmarks and many areas that are in need of improvement. We will continue to discuss areas as we continue throughout this PowerPoint and how we aim to improve the community as a whole.
The community strengths found in West End community are their physical assets. The West End community consists of many parks and playgrounds as listed on this slide. The National Parks and Recreation Association explained that just as water, sewer, and public safety are considered essential public services, parks are vitally important to establishing and maintaining the quality of life in a community, ensuring the health of families and youth, and contributing to the economic and environmental well-being of a community and a region. This map to the right shows the parks in the West End community. Highlighted in green are the local parks and playgrounds. This is also showing the boundaries of West End. Weaknesses and areas of improvement needed in the West End community include limited transportation, poverty, and limited resources. 39.3% of the West End population has access to at least one vehicle. Public transportation is available within the community, with 12 bus lines and a streetcar operating through Cincinnati Bell Connector. Poverty is also a weakness in the West End community, as the U.S. Consensus Report explains 1,546 community members are living in poverty within the West End, and 51.5% of community members are currently living below the poverty line. There are also limited resources within the West End community. There are currently no grocery stores, just mini-marts advertising beer and cigarettes. These mini-marts mainly consist of processed foods and candy. There is one fast food restaurant called Hook Fish and Chicken. There are also many food vendors that sell on the streets, including the Hot Dog Guy, which was brought to our attention by Officer Simon through personal communication. This Hot Dog Guy sells hot dogs from a shed on the street without a license. With limited access to transportation, seeking medical attention or following up on medical care may be difficult for community members, and also with limited resources, they are unable to get the nutritional needs that they require. These are the areas of improvement that we will focus in our project.
Here we are looking at the impact of determinants of health within the West End community. In regards to gender, the West End is made up of 3,701 females and 2,926 males. The population is primarily African American residents, which equivalent to 89%, and less than 1% is Caucasian. When looking at health services, WinMed Health Services is the only health facility within the West End. Services can be broken down into 8 categories: family care, pediatric care, exams and screenings, refugee services, pharmacy, dental care and oral care health, mental and behavioral health, and medication-assisted treatment. Unemployment rates have declined drastically between 2013 and 2016 and have remained consistently low until today. Employment is primarily of service, management of business, production and transportation, and sales or office work. Smog and dangerous air quality is a concern, with air quality advisories being issued within the city throughout the year. This is posing an issue for working conditions, along with the abandoned and unkempt atmosphere, including environmental pollutants, as said before. In regards to education, there's a total of 4,289 residents who obtain an education of some sort. 192 of these obtain education that is under 9th grade. 1,210 residents obtain education within 9th to 12th grade with no diploma. 1,570 include a high school graduate. 685 obtain some college education but did not obtain a degree. 140 obtain an associate degree. 317 obtain a bachelor's degree, and 162 obtain a graduate or professional degree. Out of the 6,627 population, only 1,210 have some kind of high school education with no diploma. There is a lack of appropriate education within the West End community. Continuing on for the impact of determinants of health, we continue to talk about social support networks. Social support networks include Recovery Within Reach and Tender Mercies. Recovery Within Reach is a rehabilitation facility located within the West End, offering treatments for individuals struggling with addiction. Programs are offered for gambling addiction, medical detox, short-term residential drug and alcohol treatment, outpatient counseling, support, and family services. Tender Mercies is a nonprofit organization that works to provide housing and supportive services for homeless adults with a history of severe mental illness. When looking at social environments of the West End, we found open grass areas for personal entertainment, basketball courts, football fields, softball fields, and the LeBlond Recreation Center, including the local YMCA. There is construction of the new FC Cincinnati Stadium being built, but there is controversy about this topic and questioning of its placement and whether it's appropriate. In regards to culture, there are high rates of crime as well as low education levels as previously stated. The mortality rates for the West End community were incredibly high. Between the years of 2001 and 2007, the death rate per 100,000 in the West End was 909.1. When looking at health child development, there are no individual statistics for child development within the West End, but there is current data on Hamilton County. Hamilton County had the 5th highest rate of infant mortality in the nation, with approximately 122 babies per year. The categories of these deaths include medical deaths, motor vehicle deaths, homicides, suicides, sleep-related deaths, drownings, and other types of child death, which include things like fire, burns, or electrocution, fall or crush, and poisoning. In regards to financial and social status, poverty is very prevalent within the West End. A family of one meets the poverty threshold with an income lower than $10,830. A family of two under $14,570. A family of three under $18,310. And a family of four under $22,050. Based on these provided incomes, we can see that there is a financial struggle within the West End community.
Our objectives align with the Healthy People 2020 goals, such that we seek to reduce the proportion of people who are unable to obtain or delay in obtaining necessary medical and dental care or prescription medications. We also seek to increase the consumption of fruits and vegetables, grains and calcium, and decrease the consumption of saturated fat, sodium, and calories from solid fats and sugars by members of the community. In order to address these objectives, a pop-up health screening will be conducted at a local park centrally located within the West End. By bringing health services to the people, at-risk individuals can be identified and provided with referral services so they can obtain necessary medical care. This will reduce the proportion of individuals who may delay needed medical care. Additionally, by providing fresh fruits and vegetables to participants, as well as information on where in the community they can obtain nutritious food, how they can apply for food assistance, and other community programs that may increase access to fresh foods, such as mobile farmers markets, we can attempt to increase the consumption of healthy foods within the community. In order to carry out our plan, we have set a budget of $500. This budget needs to account for supplies, equipment, staffing, and event space rental. Fortunately, the staff for the event will be made up of Xavier students and other community volunteers, including church members and health center employees. This will help eliminate our staffing costs. Additionally, much of the supplies and equipment will be donated by Xavier University, CityLink Center, and the City of Cincinnati. Other supplies, such as tables and chairs, will be donated by event partners. The event will take place in a public park in the West End, and this space will be offered to us at no charge. Our budget expenses will be used to pay for printed educational materials, bus vouchers, which will likely be discounted through our community partnerships, and fresh produce. We will also need to purchase bags to put our educational materials and fresh produce in so that these can be distributed to event participants. Our event will take place at a community park that is centrally located within the West End. The event will take place on a Saturday afternoon as to accommodate individuals who work during the week. Depending on the success of the event and participant feedback, additional events can be set up and scheduled on different days and times to accommodate more individuals. The teaching materials required for our plan include printed educational materials such as brochures and pamphlets that will be provided to event participants in goodie bags. These materials will include information on available health resources within the community as well as outside. Information on clinics, health center, and mobile clinics will be provided to event participants, as well as information regarding transportation and financial resources. Additionally, following the health screening, information will be provided to the participant regarding any areas of concern that were identified. For instance, if an individual was identified as having high blood pressure, information regarding the condition, as well as steps they can take to alleviate this condition, and medical resources that are available to them will be provided. Additionally, information regarding healthy food options within the community and the importance of a nutritious diet will also be included.
The intervention wheel integrates 3 distinct and equally important components. Number 1, the population basis of all public health interventions. 2, the 3 levels of public health practice. And 3, the 17 public health interventions. Interventions are activities taken by public health nurses on behalf of communities and the individuals and families living in them. Being that they are population-based, some assumptions about all public health nurse interventions are that they are focused on an entire population, guided by an assessment of community health, consider broad determinants of health, consider all levels of prevention, and consider all levels of practice. These are all true, which allows the public health nursing process to be applied to all levels of practice. The 5 color wedges of the intervention wheel are all included in our intervention chosen to address the West End health disparities. Our 2 health problems identified for the West End are lack of access to nutritional food sources and lack of access and proximity to health services. Our plan is to hold a pop-up health screening and provide incentives to the community members for participating. This community-focused intervention was chosen as it combines primary, secondary, and tertiary interventions that are crucial to be implemented for health promotion to be successful. The primary intervention is providing health education pamphlets to the community members while secondary intervention is performing the health screening. Tertiary interventions are acknowledged by providing fruit and vegetables for the individuals in an effort to improve current eating habits, leading to reduced health complications related to poor nutrition. Nurse-specific tasks performed include blood pressure, cholesterol, and glucose testing, as well as body mass index. Staff members can review results with community members to show where areas of improvement are needed. Nutrition will also be discussed with the individuals during the review session of the health screening to inform them of areas within their diet that can be improved to achieve better overall health.
There were following partners identified in the West End community: churches, local schools, West End Community Council, local businesses, non-profit agencies, local stores, Free Store, Food Bank, Cincinnati Library, Cincinnati Health Department, Seven Hills Neighborhood Houses, local food market, YMCA, Food Truck Association, Avondale Youth Council, Boys and Girls Club, FC Cincinnati, Greater Cincinnati Foundation, Greater Cincinnati Transportation, and WIDMED Health Services. Partners play a leadership role in the community and can enhance community engagement in the project, increase community awareness of the existing problems, also can help with advocacy efforts to build strong plan and to reach all the goals for the community. Partnership as a collaborative relationship between community members, organizations, alliances, and coalitions is a major key in accomplishing community goals. All outcomes should be reached by the end of the 2019, and they including communication system in place to reach all residents in the neighborhood and provide transportation to the nearby hospitals and medical clinics. Coming up with the strategic plan for recruiting and supporting businesses in relation to the food stores, restaurants, markets, which provide the community with the healthy food choices. Overcoming barriers to make healthy choices, to find and keep employment, to create affordable and accessible health services in the community. Also, the children and their families in the West End community will and should have access to resources that can help them to become healthy and stay healthy.
In conclusion, increased availability of resources, health education, and adequate nutrition will provide the West End community members with the building blocks necessary to lead healthier lives. This concludes our presentation. Thank you.